Welcome to the 2025 Advocacy Video Series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern in the MSW program at UNR. This series is intended to bring light to the impacts of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we continue to serve those in need and to inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Dr. Leana Ramirez, a certified HIV pharmacist with the American Academy of HIV Medicine and a certified specialty pharmacist with the National Association of Specialty Pharmacy, who is currently serving as the Chief Clinical Officer at the Gay and Lesbian Community Center of Southern Nevada, or more commonly known as the Center. Dr. Ramirez, can you introduce yourself? Tell us a little bit about what you do and why you got into this work.
Absolutely. Good morning. And I know that that was a mouthful to say, and you nailed it. So nice job. Super kudos on that. My name's Leana. Please call me by Leana. It's fine. I currently work at the center here in Las Vegas. We are a nonprofit. And we do focus on the LGBTQIA plus community. And when I say focus, like that's right, our heart and soul. However, we offer so many programs and services, and our motto is empathy lives here and to be show up as your authentic self. So we're here for the community, and whatever that looks like, however that looks like, and however that shows up on our doorsteps, that's who we help, and that's who we're here to serve. We currently have two locations, one which is our main center that's been in that location for 10 years. That one's focused on a lot of the programming, so our transgender programming, our youth programming, all those things, as well as our sexual health clinic. Um, and in the sexual health clinic, we do HIV testing, we do PrEP and PEP, and we do STI testing and treatment and partner treatment and DoxyPEP, and you name it, all in the sexual health realm. When you walk in there, you do talk about sex. You will look at condoms, and there will be dildos on the table, right? There's all kinds of things to empower people because sex should be part of the normal conversation of everyday healthcare. And we recently had our grand opening for our newest location, which is on Las Vegas Boulevard and Charleston. And that is a three-story community health center. We have our primary healthcare clinic on the second floor, and that has been open since June of last year. And then we have behavioral health in the basement, and we have on the first floor, that's one of the most exciting, I will tell you, because we have a DEXA scan, an ultrasound, a mammogram, we have laser hair removal, we have the lipo freezing, we have Botox coming soon. Like there's all kinds of cool stuff because what we're doing is we're trying to integrate healthcare in a complete holistic style, complete right healthcare in one stop, one shop. We even have dental coming on site. Like, come on, right? Like, who does that? Um, so when we first moved into the building, it needed a lot of loving. It had been vacant for about 2 to 3 years during the pandemic. There were, insects and creepy crawlers and all kinds of stuff where I'm like, ah. But I didn't know that people would come to our clinic because it did need some love on the outside. I was like, there's no way, right? Like people aren't going to come to this crazy building to get healthcare. But within the first 6 months, we had over 2,700 encounters. 2,700 times people came through those crazy looking doors to access healthcare. And so that is a testament to the need in the community. Um, and so what we're doing is we have this beautiful, gorgeous space delivering excellent customer service, excellent, personal service in healthcare out of this building. We have showers, we have washer dryer. Like there's all these things that we're trying to just kind of plug these needs in the community through this space. So it's really exciting for us, for the community. It's been a milestone for us. And it's just the beginning, right? We're always looking for that new and best thing to kind of pop up. So long-winded answer, but hopefully that that answers your question.
Can you kind of tell us a little bit about your background and why you got into this kind of work?
Absolutely, great question. So, I will say that I've had all the signs pointing to here. And I'm exactly where I should be at this moment in time. And so I graduated from the Las Vegas Pharmacy School back in 2011. I'm a Rosemont alumni. Yay! And after that, I got a position working at a specialty pharmacy. Um, and I'm a pharmacist by trade, so that's the doctor. And after that, like everything in my steps just kind of led me to here. So the pandemic happened and I was sent to work from home. And I am absolutely not a work from home kind of girl, right? That's not me. So I found the center, their STI clinic, which was still open and still offering testing during the pandemic. And I was like, heck yeah, that's my place. So I came in and I volunteered. They were open from 1 to 6, and I'd come and I'd hang out and I'd help people get on prep and pep and all that stuff. And from there, the CEO and my mentor, John Waldron, Dr. John Waldron, offered me a position, and the rest is history. Um, it's such a fantastic place being here and working here. Our coworkers are all have the same passion as I do to make a difference and to do great things through any obstacles and any kind of stuff that's put between us, right? Like it's a very difficult and challenging time right now, especially for nonprofits, especially for our community in the LGBTQIA plus world. Um, and I love to be that voice and I love to be that advocate and I love to be that person in the room who will stand up and who will speak up and who will fight for, for the same rights across the board. So again, I'm absolutely happy and thrilled to be here with you guys.
I was able to watch some videos about your recent clinic opening up, and I will say that I think that that love that you're talking about, how you love to show up and be there, I think that that is absolutely demonstrated in what I saw that you've done. You're giving that love to the community, and it is so apparent and it's so impactful and it's so meaningful. So thank you for sharing that with us.
My jam. It's my jam.
So, given the recent changes to public policy, have there been any impacts on the work that you're doing with the center? I know that support for transgender individuals and gender affirming care is offered at your new clinic. Is that being impacted? And can you tell us how?
So first and foremost, like my thought is to our community, right, and the people we serve. And um, I was brought into one of the rooms with some of our patients, and when I walk in, they're like, "Hey, when do we leave the country?" They're like, "Do we leave now? Do we leave like in a month?" And I like that broke my heart. Like I can't imagine how it feels, right, to have your bags packed and you're ready to go at a moment's notice. Um, and I'm like, no, no, we're not going to get pushed out. We're not going to get like, no, you're not leaving, right? Because we are not stopping what we do, and we're not going to be bullied, and we're not going to be, right? We care about people. We care about people from wherever they come from. So, I had a very robust conversation with them. So a lot of our population is nervous and scared, afraid that they're going to get their health records to the government or like, and I think we're lucky to live here in Nevada because we do have some of the strongest protections and some of the strongest laws that help, right, protect us, protect our providers, protect our businesses, protect all of this. And with that, we continue to offer that safe space. I tell them, come in, make an appointment, let's talk through it. Let's work through this out and that we can help educate people. Um, vaccines are a thing. I highly recommend people still get vaccinated. I highly recommend people still get on prep. I highly recommend that people still, right? Like there's so many things that are available to us in today's day and age, and the misinformation that gets put out there is just so frustrating because it does instill fear and instill lack of trust in the healthcare system. And think about where we were to where we come. I mean, the AIDS epidemic is a perfect example. Back in the 80s, right? It was a death sentence. And look at what we've done today. Today, it's a normal, healthy life with just another medication added, right? So I think it's important to make sure that you have full information and full, visibility to the things that are out there. Um, when this political climate first came out, right, and there were things being thrown out left and right. I remember the first day I'm like, okay, what's my plan A? What's my plan B? What's my plan C? Right? How are we going to navigate all of this? And then the next day it would change and be something totally different. And I'd be like, throwing everything out the window. And I'm like, okay, so now what are we going to do? This is how we're going to work through this. So I've been able to I'm like, okay, I'm going to take a step back because I can't continue to be on that path and that journey, right? I will take it as it comes and we're going to work through it and we're going to figure out a way. And what that means, who knows, right? But we're going to figure it out. So I preach that to others too. Like, watch your self-care, right? And make sure that you know where your boundaries are and where your like healthy line lies. And especially in healthcare too, with all the employees that work here, I'm asking them to go out and deal with everyone else's stuff when they're also internally dealing with that themselves. So I'm huge on self-care. Take a day, right? You need a day, take a day, recenter, rezone, like get yourself back into the moment because the work that we do here is so, so important for that people, for that person that comes right into your view. And even something just as a smile, a hello, an acknowledgement, that does go a long way. And I think that's what we need more. We need more kindness. We need more caring. Like going to the doctor's office and just finding someone who gives a darn, like that makes all the difference in the world, right? And so we strive to be that place for everybody.
Your answers are so wonderful. You're so
Oh,
wonderful.
I could keep going, right? Like, don't get me, you could get me started on talking about this. And I'm like, yeah, this is my passion and my fire.
I can definitely see that. This is your passion. So I saw, and you mentioned earlier that your new clinic has an entire floor dedicated to behavioral health. Can you tell me more about that?
Yes, so we are so excited. We have a director of behavioral health. We have a couple therapists coming on board. We have some case management going on, and we're the center. And I realized early on with coming to the center, like although we want to be everything for everybody, it might not always be us. So we have a huge network of like referral partners that we can also, especially in behavioral health, right? Like you're going to sit there and you're going to bare your soul to this person. So you want that person to be invested in you and to, right, see your views and be someone that you're comfortable talking with. And you might have to go through 3 or 4 different people. We're going to help you with that. We will help you navigate that to find that right person to be able to get you to the next level. And behavioral health doesn't always have to be sitting and talking with a therapist, right? Take check-ins with yourself mentally, just like I was talking about earlier, right? Like, what is it that recenters you and brings you back to your zen? With me, like just walking outside, right? And I'm like, I gotta feel the sun on my face. Like, just be cognizant of that. But again, I'm so excited. We have 2 beautiful spaces that are group therapy rooms. One of them is a classroom setup, and then the other one is more of a living room setup. So that people can come sit on a couch, bring their cup of coffee, right, and hang out and build that community and build that, that kind of connection with people. Because I think again, if we just care about each other and take a moment to talk to each other and understand each other, think of the impact that that would make and create in our world.
I am an advocate for mental health myself, so I very much appreciated the priority you guys are giving to mental health and behavioral health. I think that in these trying times, it is more important than ever.
Exactly. And sometimes that's just a friend or something, right? Like, yeah, there's a lot that we need to do for each other moving forward. And that's the only way we're going to get through this is together.
So, do you anticipate any impacts in the future given the policy changes?
Absolutely. It's it's a new, right? It's fairly new. We've already seen some weird things happening with some of the grants and the awards and the funding. Um, but I will tell you that here at the center, we will not tolerate it. We will do everything in our power to make sure that we move forward. Um, and, there's a bunch of different things that we have in the works that are going on with that. And like, my focus every single day is sustainability. How are we going to make sure that this is here in, 2, 5, 10, 20 years, and that the message continues to stay the same and we carry that through legacy, through our next generations. Um, so, I I love to tell people, like, support the people that work hard for you, right? Show up. Showing up is probably 9/10 of the thing that we can ask for. Um, Let us know what we can do more for you. And um, you can bet we're like banging on some big doors out there, right? To try to get whatever is we need. We accept donations. But again, uh, we we just make sure we do the best out there. And whether that be private, whether that be donations, whether that be endowments, whether, um, that's one thing that has been very humbling is how the community has come together to support us in these new endeavors. And with every dollar that comes in, we absolutely make sure that that dollar goes right back into the things that matter, that go right back into the behavioral health programs, into the transgender programs. Heck, we'll even pay for people's medications and copays and like, we do so much that, that we make sure everything is spent really, really well. And we have audits. We have third-party audits that come in and we've always done really well on those. We've gotten perfect audits the past few years. So, um, money is a big thing, but it's not everything. And, we're lucky enough to be able to have people come in and we don't have to worry about how they're going to pay for the labs or how they're going to cover it. Because, again, we do everything in our power to make sure that all the people who come in have to worry about is themselves. They just have to take care of themselves, and we will help get them rewarded for doing that.
Thank you again for taking the time to speak with me today. And for those tuning in, thank you so much for hearing Leanna's story. Please like, subscribe, and share, and check out the other videos in this series. And Leanna, thank you so, so much for meeting with me today.
My absolute pleasure. And please feel free to reach out if there's ever anything that I could do for anyone. We are the
All right.
center.